This is the formal welcome to the Wellness Sector Spotlight. You can mute everyone. Newest trends in wellness for cancer. Early.
Susie, I need you to unmute. Sorry, I was just waiting for a moment for that.
Okay, I'm going to unmute. Everyone else is muted. We can start. Thank you. So the title of this sector spotlight is the newest trends in wellness for cancer. Early detection, inclusivity, access, and immunity. And Julie Bach is going to be the moderator, and we have an expert medical panel. So thank you all for joining. And you can move the slide off.
Yeah, but I have to go because I'm on this thing. Okay, bye.
There we go. Okay, so welcome to the Wellness Sector Spotlight. I already gave you the name, and I'll introduce myself for those of you who don't know me. My name is Susie Ellis, and I head up a great team here at GWS, where our mission is joining together, shaping the future. And while we do that via our annual Global Wellness Summit that started 15 years ago, we also have had tremendous success with our virtual gatherings like this one. We have had almost 500 people sign up for it, and over 50, I think it was 59 countries. Not everyone will be on the call, but we usually have about a third or so, and then others access the recording later. And we do have a recording that will be available. By now, many of you probably know that our 2021 Global Wellness Summit is going to take place in Boston this year at the beautiful Encore Boston Harbor, which is a wind resort similar to the one in Las Vegas, but it's brand new, and I'm really looking forward to seeing it. The summit will happen in person and virtually, and the dates are going to be November 30th through December 3rd. And the theme, which is so appropriate for what we're talking about today, is the new era of health and wellness. We're really looking at what's happening with medical and wellness and how they are collaborating, working together. So this sector spotlight is really an example of that. The other organization that I'm proud to be part of is the nonprofit Global Wellness Institute, or GWI as we call it. And its mission is empowering wellness worldwide. And today's sector spotlight actually showcases one of our GWI initiatives called Wellness for Cancer. This initiative is headed by Julie Bach. She's the executive director of Wellness for Cancer, and Dr. Lisa Corbin, who is with Executive Health Services, the University of Colorado Hospital. And one other announcement I want to make before I introduce Julie and the panel. I'd like to let you know that the Global Wellness Institute is doing our first symposium, the first one on wellness, real estate, and communities. That is a sector that you may or may not know has actually gotten a lot of energy and momentum from the pandemic. This Wellness, Real Estate, and Community Symposium is going to take place in New York on September 28th, and the agenda is being shared later this afternoon. Nancy, did you want to just say anything about it? This is Nancy Davis, who is a partner, and Nancy, just want to say hi and
sure. I'm delighted to say hi, and always happy to see Julie Bach and support anything that she's involved in, because she is a bright light in this industry and for something so deeply important. The symposium in New York is going to be absolutely amazing. It's one-day focus, a deep dive on everything from architecture and design to kind of the whole reframing of that business due to everybody's focus on health and well-being in the built environment. So it's going to be really, really wonderful. It is also virtual. So if you can't be with us in New York in person, please sign up and join us virtually. It's going to be a great day. Thank you, Susie.
Thank you, Nancy. And so let's go back to today. We have an expert panel, and they really are experts. They're going to be presenting the newest trends in cancer detection and treatments, and analyzing their profound impact on the wellness industry. As Nancy mentioned, moderating that panel will be Julie Bach. She is recognized for building a bridge between medical experts and wellness professionals and serving as a thought leader on establishing evidence-based guidelines for cancer. I have to say, I remember back, I've had many decades in this industry, but I remember back, and actually it's not that far back, when someone with cancer was not really welcomed into a spa setting. I think, Julie has helped change all that, and we have a new era now. And before I turn this Zoom call over to you, Julie, I know you'll be giving a more formal introduction for each of your esteemed panelists, but I did just want to take a moment to thank them. I believe we're going to have Dr. Minetta Liu from Mayo Clinic, Dr. Shamal from Singhale from Silicon Valley, Dr. Johannes Vesoli from Miskawan Health Group. And Johannes, we met in Hong Kong a few years ago. You may not remember, but I remember meeting you at that one gala event. And then Becky Kuhn from Oncology Spa Solutions. So thank you all for giving us your time and expertise for this important conversation. And now, Julie, please take it from here.
Thank you so much for that beautiful introduction. And I want to thank everyone for coming and RSVPing for those who are watching this on the replay. Cancer is not the sexiest of topics for our industry when Dr. Weil said, let's make wellness sexy. But I believe that today we will talk about the innovations, which to me is quite sexy from a geeky standpoint, and start having a robust conversation on the impact of some of these trends. As we move more with medical, it's very important that we have a shared vernacular, especially if we're starting to provide the same services. And is it called the same thing in both locations? So some of the things that we'll talk about when we talk about the wellness piece, we'll be thinking through some of those things. I'm just going to briefly ask each of our speakers, when you do speak, to give a quick introduction, a few words about yourself. Everybody will get a handout after the call when it is sent out that will go through the trends, and you'll have a bio on each of the speakers. So we really want to stay focused on time here today. I'm so honored to have Dr. Liu, and I did see that you're on the call, so I'm very excited. I get overwhelmed when there's over 100 people on here, but that shows that this is a global level of interest, which is one of the things that the initiative wanted to show, was that cancer is relevant and it's globally relevant. So Dr. Liu, if you could unmute yourself, go ahead and introduce yourself. And I'm so excited to share the gallery test. What is it? What makes it different? And to start thinking through, how does this impact the world of wellness? So Dr. Liu.
Thanks, Julie. Thanks, Susie. And I'm humbled by this international audience. I was looking at the chat, all the hellos coming from around the world. So I'm sitting in my office in Rochester, Minnesota. It's not that exciting, but maybe this is the power of what the pandemic has put us into, this ability to have a virtual meeting, and you're all hopefully comfortable in your living rooms. So I'm a medical oncologist here at the Mayo Clinic, at the cold one in Rochester. We have 2 other sites in Arizona and Florida. In the clinic, I see breast cancer patients. In the laboratory and research-wise, I do a lot of work in blood-based biomarkers. And it's been my belief for a very long time, I've been in this for about 20 years now, where instead of having to get pieces of tumor tissue, we should be able to find tumor material in the blood to help us make decisions about personalizing care for our cancer patients. And although I am a medical oncologist, so I use medical therapy to treat patients, my goal is to put my kind out of business, because if we find cancers earlier and we are smarter about how we diagnose and treat them, you'll need less therapy. And that all leads to us feeling better. And everything we're doing is about our quality of life every day. So that's just a little bit about me. I'm here to talk to you about early detection. And I wanted to give you a little bit of the history of how we've gotten to where we are in multi-cancer early detection, which is a complete paradigm shift for 2021, and hopefully more so in the future. We can talk a little bit about the Gallery test. It's a specific test that just went commercial in June, but I want to keep this agnostic to actual assays. I'm not here to do an advertisement for any company. I am in cahoots with a lot of them because that's how we do better, right? We'll start with one and we'll learn, and other products, if you will come into availability in the clinical practice. So I want you to understand the principles of it, where we are now and where we can go. So tumors, as they develop, do either push into the bloodstream or shed into the bloodstream some of their factors, right? So proteins, DNA, RNA, it's the innards of a cancer cell. And if you picture the blood, it's like a cauldron of all of these different things. But the blood also carries with it a lot of normal proteins, DNA, and RNA. So for the longest time, technology didn't really allow us to find those little tiny bits of tumor material in the blood. But over the past 20 years now, there's been the advent of technologies that allow us first to get cells, so actual cancer cells in the bloodstream. But now, and for the longest time, we could do proteins because there's sort of these big things floating around. But the nucleic acids of the DNA and RNA, which are very specific to cancers versus normal cells, only recently have we been able to detect those very little amounts. So all of that technology started looking in advanced cancer, right? There's more tumor burden, there's more sites of involved disease, so more of this material spilling into the blood. And we've learned that we can use that, to use the blood and the DNA in the blood to characterize cancers and help us define treatments, right? So instead of having to stick a needle in different tumors, we can just get this from the blood. Still involves a needle. It's not non-invasive, but it's minimally invasive to get blood as opposed to biopsies. So that was one major advance. Then we want to take it earlier to the setting of cancer is diagnosed at an early stage, right? Surgery is done. You have to come see the likes of me to determine whether you need adjuvant therapy or some defined period of medications trying to squash cancer cells that I can't even tell you is they're there, right? And so we're giving medications presumably to patients who may not even need them, but this is in the hopes that we're giving it to people who need it, who then we reduce the risk of recurrences, right? And we know that we can help people. We just don't know exactly which people we help, right? In medical oncology, I only know that I failed, quite frankly, at least up until now. So I always tell my patients, I want to grow old with you, and that's how we'll learn that we've succeeded, right? But now we have blood tests where after surgery, before medications, if we find tumor material in the blood, can help define those individuals who are at a higher risk of recurrence, right? So maybe those are the patients who really need to be treated versus those who don't need to be treated beyond surgery and maybe radiation. So we're in that place right now where we're trying to determine if that's the right thing to do. But what we're really here to talk about, and what's so exciting, is that even about 5 years ago, the technology got to a point where you could find such little tumor material in the blood that you could even use this, and now we've proven this, in a situation where someone is healthy, has no diagnosis of cancer, but you might find a signal of cancer in the blood to help screen for those cancers that we can't screen for now. So that's a mouthful, and I'm going to talk to you now a little bit about early detection and then what this blood test might mean. So for all of us, once you get to the age of 50, or if you have a high risk criteria for developing a certain cancer, and that could be a family history, an inherited gene mutation, we do what's called screening. So you feel good, you look good, but once a year, once every 10 years, you might have to go get a mammogram, a colonoscopy, a pap smear. We now do low dose CT scans for lung cancer in people with a history of or who are current smokers. There's a whole conundrum around PSA screening for prostate cancer. But those are the only 5 cancers, 5 screening studies that we do. Those are called single cancer screening assays, right, or tests. But they're all done at different ages, at different time intervals, in different clinics. And we all have better things to do, right? And it's hard to keep track of everything. It's also not only time consuming, but expensive. And not everybody complies because it's inconvenient. I mean, I don't want a colonoscopy, right? At least we can now do stool DNA, so that makes it easier. but you have to collect the stool at home and send it in. Like some people don't like that idea either. But imagine that the rest of the cancers out there, pancreatic cancer, ovarian cancer, brain cancer, sarcomas, head and neck cancers, we have no screening for. So people will typically present at later stages because they have symptoms, and then you tell your doctor, and then that prompts a workup. Imagine for those cancers that we could draw blood, say once a year, that blood test would be representative or could test multiple cancers at the same time, single blood draw. It would cover not just the cancers that we already screened for, but the cancers, importantly, that we don't. And this is not to replace the mammogram, the pap smear, the CT scan, the et cetera, right? This is to use in conjunction with that if we diagnose cancers at an earlier stage, we are more likely to be able to cure them. And you'll put me out of business. Remember, that's the goal. And I'll be a dog walker. I'll be very happy. So we don't have to worry about what at least what I would do. So we are, again, now in this era. It started about 5 years ago, the first company that decided to enter this space. There are now multiple companies that are developing these types of blood tests. And these companies are working in partnership with academics, folks like myself. We can't do this in our own shops and academics. You have to imagine the investment, right, of dollars, of time, of expertise to be able to develop these tests technically, but then you partner with clinicians and researchers and the academic and community places where the patients are, right, to figure out if those tests should be used. So there have been really 2 blood tests that have been put to the test in what we call pilot implementation studies. In other words, they got far enough in development that they were tested in patients who were of screening age, who didn't have cancer, right, known cancer. And these tests will report a signal of cancer signal detected or cancer signal not detected. They do it in different ways. We're not going to get in the weeds about the technology. Happy to if you want me to. Some of these tests will also report where that signal is coming from. So imagine you're a healthy person, you get your blood drawn and it says cancer signal detected, but that's all it says. Okay, I know I would like, oh my God, where is it? Talk to my doctor. What test do I have to get done? Do I get a scan from head to toe, et cetera? You can imagine how healthcare costs could spin out of control because you're hunting for something and you don't even really know it's there. So having a signal origin predicted as well can be helpful because it'll let your doctors kind of hone in on where to look first, right? Is it coming from the breast, the colon, the lung, et cetera? So the first test that was commercially launched is called Gallery, as Julie mentioned before. It is a product that comes from a company called Grail. Grail was a company that was born 5 years ago with the specific intention of developing a blood test for cancer detection. There are now multiple companies not that far behind with tests available as well. This one is, though, commercially available, so it's out there, right? Your doctor could order it for you with the right sort of guardrails and education, et cetera. It does report cancer signal detected or not, as well as the cancer signal origin. The pilot implementation study that was done showed, importantly, this was safe to do, right? That yes, we did find cancers. We also found some people who had a signal but no cancer. But whether that's because the signal is false or because it's heralding the development of cancer later is what we have to learn. This is all happening so quickly, right? So we have to follow these individuals over the course of time to see if those who have a positive signal, in fact, basically are at risk for developing that cancer in the next year or two, whenever. So that follow-up is happening. There were anxiety questionnaires done because one big worry is that, again, this is about creating wellness and improving our general health. How is having a test and generating that level of anxiety going to impact our mental and physical well-being? So those questionnaires done, both of the providers as well as the patients who enrolled in the study, suggested that people, granted, they entered these trials, right? So we might be selecting for the individuals, but the anxiety scores before and after didn't change. So it said that people entered this as long as they were well educated and they understood what they were coming in for, didn't have those huge escalations of anxiety that we might worry about. It's also important to be sure that that test doesn't trigger unnecessary workups and procedures, right? Because that's, going to impact the healthcare system as well as, again, our general well-being. And although there were some procedures done, there were mostly scans that were done. And we can see somebody's email, so whoever it is, you might want to know that. Again, having an X-ray or a scan serving as a baseline in people who have a signal is not a bad thing either. So we know it can be safe to do, and this is where we are right now. More tests are going to come down the pike. We need to have trials that demonstrate what we call utility, meaning that, okay, you could find a cancer, but if you act on it now, does it really make a difference in the long run in terms of survival, in terms of healthcare costs, in terms of everything? So those trials are being designed. And again, they can only be designed now because we only have the tests now, and a lot yet to learn.
So Dr. Liu, I'm going to just in the interest of time, just pop in for a quick question here. So this concept of we're able to do earlier detection because actually it's easier also for individuals to do, but how does that impact maybe some of their decisions with lifestyle or other kinds of choices now that they know that there are some markers that have been found? Granted, maybe you haven't followed through with clients yet, but how could we help them?
Well, I think it's envisioning how this test will help in the future, right? So we have the ability to screen for cancers we couldn't screen for before, because it's not like we're getting whole body scans every year. People will tout that, please don't do it. It's definitely not good for your health, I don't think. But you could imagine if this blood test, if multi-cancer early detection, certainly you find cancers earlier, you're going to go down a road of therapy. But in those individuals where a cancer signal is detected, that may be, again, a risk factor. The question is it a modifiable risk factor? And that's where looking at prevention strategies, maybe those are the individuals that we need to focus on for our prevention trials, whether it's related to acupuncture, it's related to complementary alternative therapies, it's better exercise, it's better weight management. That might help us because the prevention studies that are done to date oftentimes don't show positive results. And I would argue because we're not looking in the right patients.
Perfect. Thank you. So I'm going to move on to our next speaker, but hopefully Dr. Liu, you will stay on as well. For those of you that keep popping up with your emails and your faces keep popping up, if you keep yourself on mute, then your screen won't overlay our speakers. Except for my teenager, he's loud, so I might get popped out here in a second. So we're going to move to Dr. Singhal right now, and then we'll come back to the medical side in another breakthrough. So Dr. Singhal, I'd love for you to introduce yourself, and in the interest of time, since there's so many people here from the medical arena and the wellness arena, I want to pick up on this concept of mind and body. What is it and what does it look like?
Sure. Thank you, Julie. Am I off mute? Yes. Thank you. It's so nice to be here with all of you. Just as a quick introduction, I'm a surgeon. I'm a surgical oncologist, and I worked in the lab for a long time. My PhD's in pharmacology, and I came to Silicon Valley, and we built a cancer program. And we built a cancer program around people and around this concept that cancer is a disease that affects your mind and your body. It's emotional as well as it takes a toll on your body. And so when we talk with our patients here, in my private practice and in the clinic, we really try to emphasize that there's pieces of it that we clinicians provide for you. We tell you about your scans, we do all these things that are related to your body, and as I'm a surgeon, I take out the cancer, and that's my contribution. But there's a whole team of people that take care of patients, and having this idea that your mind and your wellness and how you approach this critical time in your life is part of how we care for patients. And it's a concept that other people, but we often run out of time, right? We have a 15-minute visit, we have a 20-minute visit, so we don't always have the time to really see where patients are and whether their mind is catching up with their bodies, and whether they really have the skills to cope with all of the things that are happening to them in this critical period. So in our facilities and with our patients, we have a whole team of people, and I'm sure other facilities have the same thing. And each person has a contribution to make to the wellness of that patient and the healing of that patient.
Great. So I want to continue with that. Unpacking a little bit about living versus fighting, right? And living through this time of treatment versus putting your life on hold. So can you help us understand a little bit more about the psychological, I suppose, impact of the client?
Sure. So if you go into the doctor's office and they tell you you have a diagnosis of cancer, most people, it's a stunning moment of realization that your world has changed, right? And often I am the deliverer of that news, that this is changing your world, and trying to put a framework for people that says, listen, we're going to get through this. We're going to fight. And when you say that word fight, you're going to be a warrior for cancer. You're going to get, this whole team's going to fight on your behalf, right? That implies a sense of, urgency. It implies everything else drops out, and this is your only place that your whole world is going to be focused about, right? But remember, we have done well on early detection. We've done well on surgery. We've done well on radiation. We've done well on medications. People are living a lot longer with cancer. It's not the disease that it was 50 years ago. So we have to prepare patients for this idea that we're going to treat you. You may do really well, and you may get back into your regular life. And this idea that you don't shut off your entire life to deal with your cancer would be really a welcome thing, because then it's easier to get people back to their regular life because they kept a portion of it while they were dealing with the cancer. And so it's a very difficult thing not to convert all your energy to the cancer treatment. But if you're able, then keeping a little portion of normalcy, like you're going to go for a walk, you're going to see friends, you're going to go for yoga class, you're going to do something that allows you to keep some portion of your daily routine.
You and I have talked before. So what happens is when people are fighting, right, there's also the sense of control, and people or individuals that may show up at the spa, let's say, or at a wellness destination when their treatment is over, they kind of fall apart.
Yeah.
Right. And they fall apart because?
Well, they fall apart in part because finally they're in a place where their mind kind of catches up with their body. And, I have, lots of relationships with patients, but they don't always tell me what's happening with them, right? It's a very controlled environment, the clinic, right? We're talking about specific items and specific things that relate to their disease. But when they are in non-clinical environments is when all those emotions come to the surface. All of their senses of mortality, all of their challenges with how their daily life is. And a lot of times it's not with me, the physician, do the hidden disabilities come out. It's really with other people. It's with the people, the social worker, the nutritionist, the whoever.
Right.
And I think it's important for the people who surround these patients to understand that their fears, their anxieties are going to come out in those settings.
Sure. So two things I just wanted to point out that we had discussed before as well is that for those individuals that are fighting and they're living by their planner, right? And then when they're done with treatment, there is no planner. There is nothing to fight. There is nothing to control. Those are the ones in a way that are at the highest risk in a way of, I don't want to say falling apart, but having that emotional situation going on because they have made cancer and fighting it their mission.
Yeah, and It's interesting. I joke around. I have a couple of patients currently who are what I call planner people. They come with their notebooks, their file folders, their spreadsheets of all the way it's supposed to go, and they have trouble making the transition to this fight is over in the day to day. And there's some tools and techniques that we work with them about. We have a cancer psychologist that works with them, and again, it's this whole concept of team, right? And we, as Dr. Lou said, we want to grow old with our patients, right? There at some point you're transitioning from active treatment to surveillance, and you're transitioning from someone that we see every week to every year, and that transition sometimes is hard for patients to do. And as I said, I'm a surgeon, so I see you early on. I see maybe acutely, maybe in the ICU and all of that. But then as time passes, you see me less and less, right? You're going to end up seeing other people.
Perfect. So a lot of doctors have said in the past too, is during this time after treatment is a great time for the wellness industry to be able to support. Also, as we talked about with Dr. Lou, it's also a good time to support as well, upon any kind of change, to see if an individual can make lifestyle choices. And you gave me a really good information yesterday, and please, any of the doctors can chat in, but we were talking about how many cells actually have to become cancerous for it to be in, what was it, one piece of tissue. It was a lot.
Yeah, so we talk about, we talk about detection because people recur, and then you have to find the recurrence. And so only at which point can you see about a centimeter of tumor, half a centimeter of tumor, but that's 500 million to 1 billion cells when it recurs as 1 centimeter or in a lymph node or something like that. So it's a substantial amount of cells that create a solid recurrence.
And so one of the things that you had mentioned to me before, and Dr. Lou, feel free to hop in as well, is that there are reversible choices that we can make so that the cancer hasn't progressed to such a point that it's stage 4. It's actually caught earlier so that it can, in a way, help to reverse the environment of the body. Anybody want to take that on?
Well, so I think of things like reversible things such as smoking, such as sun exposure. Those are things that we consider reversible. You have a choice to smoke. You have a choice to go out in the sun. And so those lifestyle choices are pretty important. And we should also acknowledge that things like eating red meat, right? Red meat is a promoter of multiple cancers. In the prevention of lifestyle choices that might lead you not to develop a malignancy. And I would just make a point about, and Dr. Luke can probably speak to it more than I can, is that smoking affects your whole body. And there's 12 smoking related cancers. And it's not just lung cancer.
Perfect. Beautiful. And one last question, then we will continue to move on. You mentioned a word a few minutes ago that I really wanted to hone in on, is this concept of hidden disabilities, right? And so some of this has to deal with body image and the need for validation outside. And you're a surgeon. So unfortunately, when it comes to breasts and it comes to head and neck, we do get quite a bit of disfigurement from the surgery. And so the body's a little different now. Can you talk about that, as you had mentioned that term, hidden disability?
So hidden disability to me is all the stuff that people don't really tell you. So when they look in the mirror, and I just give you a quick anecdote. I have a longtime patient who, she had breast surgery, probably 15, 20 years ago from another surgeon. And then she recurred. So we had to do a mastectomy. I was just asking her, hey, how's it going? And she said, oh, I'm remodeling my bathroom because I can't get out of the shower and look at myself because I've been maimed. And I thought about it a little bit, and I was so happy. She's 25 years. She had a small recurrence. We dealt with it, and she's still alive 25 years later. I did not really understand the impact to this woman's life. Like, she has not worn certain t-shirts. She has not gone out of the house. She has not done a lot of things that I would have expected her to do over 25 years. And I started asking the patients in clinic about some of these things. And they said, oh, I didn't realize that I wasn't going here. I didn't realize that I didn't do this thing. And so that's why I coined this term a little bit of hidden disabilities, because either you don't realize that you've put blockades in your life, or you don't want to talk about it because it seems like a vanity item.
Sure. Okay. So there's a few comments that are in the chat right now, which I can address, and then we will move over to immunotherapy. So some of the questions have been around how do we help people? How do we help them do goal setting and things like that? And one of the trends I wanted to just quickly address, now you can see I have a bunch of things open, is about yoga. So that's not my yoga slide. There's my yoga slide. So yoga actually is one of those mind-body tools. One of the questions in the chat was, how do we help a person not become their disease? Well, first, that's a mindset that they have. And it's going to depend on our scope of practice, right? So we need to be a little careful that with so many people taking mindfulness classes now and things like that, that we're not trying to cross over into psychology, right? But there are definitely frameworks that we can use, and yoga is one of them. So a lot of times in the West, we think of yoga as just exercise and movement. And certainly there are aspects of yoga that can help from a fitness standpoint, that can help with a range of motion. Right now, I can raise my arm. It may take me a year after surgery from Dr. Single, but I'll be able to do that. Maybe I'll be able to move my neck. So increasing flexibility, increasing strength, increasing coordination and balance, respiratory. These are all the things that the asana, or the posture portion of yoga, promises. Within yoga itself, within the clinical research of yoga, cancer is the #1 thing right now that is being researched. So yoga has a very large place right now when it comes to complementary medicine, and that 89% of the National Cancer Institutes in the United States provide information about yoga, and 69% actually offer classes on site. And so it's beautiful to see, and I believe during COVID, we all have seen this emergence of yoga, not just postures, but also breathing, relaxation, meditation, and mindfulness. So learning how to regulate our emotions, having a greater awareness of who we are beyond that physical. And that also deals with spirituality. So I wanted to quickly, in the interest of time, put a nesting doll picture up here, and really just looking at the nesting doll, not necessarily the information on the right-hand side. But yoga is very much like a nesting doll. You start with the physical components of the body, and some people identify there. So this addresses the question of, how do we help them become more than their disease? Well, first they have to understand what they are, right, from a yoga perspective. So it's the physical component, the outside. That's why we do sometimes the movements, because people are associated with their physical body. But with a nesting doll, right, you take it off and there's another doll underneath. And that next doll underneath, that next layer, it's called pranayama, the prana maya kosha. And prana in yoga is the life force energy. So you can't live without a life force within you, without energy. It's the energy that makes the body move. It's the energy that moves the blood. And this is, again, from a yogic perspective. This is where breath fits in. So we hear a lot about breath work teachers, breath work trends, and a lot of it stems back from the yogic tradition. And the breath is a link between the physical, because we can feel the breath. Sometimes we can even see the breath, right? And then we peel the layer down a little bit lower. And now we get into the things we can't see. You can't see your mind. You can't see you. I would challenge you to do meditation to try and find yourself. You cannot find yourself in you. But those are the deeper aspects of yoga till you get to this small little doll at the end, which is bliss, which is your natural state. And the reason I bring that up is because we are very fixated with the external. But if you keep going deeper and deeper, you find you can, if you want to, find what you are. And that is where yoga can help people go beyond recognizing that, or recognizing themselves that they are their disease. And so there is a lot of promise with yoga, and we meet people where they are. Yoga therapists meet their client where they are. I'm not going to go into spirituality with them if they're really working on their range of motion. How many of you just really quickly have taken the Calm app or Headspace app or taken a Yoga Nidra class? Any of you? Okay. Yoga Nidra, very popular in our spa setting. What is Yoga Nidra doing? Yoga Nidra is taking a person in a relaxed state. It's actually called corpse pose, your final state. And it's taking you through all of these nesting dolls. Whether you know that or not, that's what the yoga practitioner is doing, is taking you through all of these deep states. And that's why when you're done with Yoga Nidra, you feel so peaceful, because you have put all these other layers, the body to sleep, the mind is calm. So you're going deeper and deeper into a relaxed state. So I just wanted to share that because yes, I am moving on to my other guest. I just got a little note. So we have one trend left that we wanted to talk about was immunotherapy. And that is Dr. Vesoli, if you could come on, please, and talk a little bit more about immunotherapy in about 5 or 6 minutes, talking about it, and for us to understand what it is and how it helps us to understand the journey of our individuals with clients with cancer.
Can you hear me?
Yes.
Okay. So I want to introduce myself. I'm Johannes Vesoli. I'm from Germany, and I'm the medical director of Miskawan Healthcare. We are a group which is mainly in Thailand. We have 3 clinics in Thailand, 2 in Bangkok, 1 in Samui, now preparing 1 in Phuket, and of course in Germany. And I started as an anesthetist and intensive care doctor, but slowly I found that the functional medicine is more fitting for me, and that is why we treat our patients in a holistic way. I'm very happy to hear all these speeches, because in our clinic, especially the one in Bangkok, which is exclusively for cancer patients, we also offer yoga, physiotherapy, nutrition, psychology, and there's a lot of things we can offer. I only want to speak about the immune system. I don't speak about immunotherapy in the sense of antibodies, artificial antibodies, but we all know that our immune system is our life insurance. And without our immune system, we cannot survive cancer or any other disease. And it protects us every day, otherwise we would be dead after 2 days. And so how can we check the immune system? There's 2 parts. Prevention. We have a lot of functional tests which show us the stability or the potential of our immune system. Our immune system consists of it's like built like an army with different branches. We have different types of cells with different actions in the body, and they work together very closely because they need their mutual information to work properly. What we can do is in prevention, we can already see how good in functional tests, how good the natural killer cells are working, the T cells are working, the macrophages are working, the dendritic cells are working. You can see all that in functional tests. And then you can see, okay, the immune system is in order. And if not, we can test different natural substances with which we can increase the killing capacity, for example, of killer cells, or the cytotoxic activity of T cells, or if there are enough M1 macrophages there, which are necessary to attack the cancer. And all that is tested already in healthy people. So that is the cancer prevention program. But when we see that there is already a cancer there, or especially after aggressive cancer therapies like classical chemotherapy, this immune system is most of the times completely destroyed. And without building it up, a patient will not survive. That is quite clear. And because with all the therapies, radiation, chemotherapy, other therapies, there's always some cancer stem cells left. And that is the experience we have, that after a while, the cancer comes back. Why? Because the immune system has been killed and the stem cells of the cancer can develop as fast as they want. And so we have a few weapons we can use if we see that a therapy has destroyed the immune system. For example, we can take the natural killer cells from the patient, expand them outside the body, and wait until we have a couple of million of cells, and then we reinfuse it into the body. We can enhance the macrophages, for example, with a special kind of GC-MAP. So the macrophages develop only in M1 macrophages, which attack the cancer. And we can, we plan to have a NK cell banking made from allogenic stem cells. We can manipulate the stem cells so that they develop into killer cells, especially for patients who have nothing left of their killer cells or other immune cells. That will be the future. And the problem is that in the different countries, the approvals by the FDA are different. We can do in Germany, for example, other things than in Bangkok, but we are now doing all these studies to have a lab in Bangkok, which can provide us with all these therapies. In Germany, we can already take out all these immune cells like B cells, macrophage, dendritic cells, T cells, killer cells, and expand them outside the body and give it back in 3 different groups in high numbers. And so they can do the job, because the milieu in the body after a cancer therapy, for example, is sometimes so full of poisons and full of rests of the chemotherapies that the immune cells cannot develop in this toxic environment. And that is why we take them out, catch them outside the body, and then give it back to the patient.
Perfect. So Dr. Liu, I wanted to invite you a little bit into this conversation as well, for us to understand the impact on the immune system and some of the ways that medicine has progressed.
Sure. No, thank you. And thank you for that amazing talk. I think what you're hearing is, and there was a question before, I think it was directed at me, so you didn't all have the advantage of seeing it, but if you find cancer at a really early stage, is it possible that the human body is already fighting that cancer by itself? And one thing that we have to realize is that our bodies are always developing abnormal cells. And our innate immune system, what you are born with, is so phenomenal that it can clear many of these cells. Unfortunately, it doesn't do it all the time. Sometimes one will escape, and that's how we develop a cancer. So what the therapeutic technologies, the treatment medical technologies have done for us now is figure out ways to try to manipulate our own immune systems to better recognize cancers, right? So this is what immunotherapy is all about. Where traditionally we were giving medications that directly would kill or alter a cancer cell, immunotherapy is giving you a medication to heighten your own immune system. And there are multiple factors interplayed in the immune system, but taking different components of them to recognize the cancer. So in fact, it's strengthening your own body to kill the cancer cell. It's like phenomenal. And so when you're hearing about cells getting taken out of your body, manipulated, put it back in, I mean, that's what's happening. So this is taking advantage of something you were born with and maybe making it smarter. Our immune systems vary, some stronger than others. And so this is where medical therapy can be helpful. So I'm totally excited by immunotherapy. I think everybody is. It's been a bigger success, that's the right term, in some cancers than in others, but there's a whole power of research ongoing right now to figure out how to make it sort of a general way of how we treat individuals with cancers.
Great, beautiful. And I have one last question, and it can be to any of the panelists as well as Becky, because we haven't heard from her yet. And we've seen quite a few from some cancer survivors commenting in there. And what's beautiful about Becky is that she is a cancer survivor. And many times people who are being cancer advocates are being cancer advocates because they've been indirectly, like I've lost both parents, I've lost sisters, I've lost family members, but I myself have not experienced cancer. And so there is a difference of experiencing it also firsthand versus witnessing it, right? And talking in a third party. So I wanted to invite Becky in for a moment as well to just share anything that maybe you've seen in the chat or we haven't addressed from the perspective of someone who has gone through. How can we help people either feel more comfortable about themselves or looking in the mirror, or how do we address our clients? Are they cancer clients, or are they clients and we're looking at them as a whole person, not defining them by their cancer? So Becky, if you can unmute, introduce yourself and hop right in.
Julie, thank you so much. And I have to say, I'm so excited about all these new advances in cancer and hearing from the doctor team. Thank you so much for all that you guys are doing to help really make the cancer either go away or be a much better, smoother process. I think that, my goal, so I founded a company about 12 years ago to start working with cancer patients outside of the hospital, because I found that cancer centers have a stigma to them and people go there when they have to, but they don't want to go there when they want to heal. And I'm talking about really the psychosocial aspect or the well-being of a person. So I've spent 12 years really trying to integrate wellness into the spa. And how do we do that? I think it's important. One thing you just mentioned is that no, we don't treat them as a cancer client. We treat them as a person. We treat them as a client, and we learn how to customize our services for their safety, for their comfort, for them to be able to get into a space where they can feel like normal. I think that's really important. And I think that's the thing I hear all the time from my patients, my clients. They say they just want to feel normal, whatever that is for them, because it's different for everybody. But being able to have some cancer background and being able to understand maybe possibly what this person has gone through is very helpful in a spa situation. And then learning, again, not to be afraid to work with them. They're a person, they're a client, just like any other client. I'll use the word that Dr. Singhal said, with some hidden disabilities. Okay, so they have some problems or some issues that they might not be telling their doctor, but they definitely tell us in the spa. So I think it's important to learn how to listen and then move forward with compassion and care and help them to, heal in a very normal way in a spa.
So you and I have been doing this, I'm just conscious of time. So you and I have been doing this for quite some time, that when we first started the menus, we tried to make cancer treatments, right? Because it was called oncology massage in the medical setting, right? So, we came out with the cancer treatments and tried to make them sound really nice. And over the last 14 years, our thinking has really changed because of the way that individuals don't want to be defined. And so it is more about personalized wellness, not disease care, right?
Yes, absolutely. And I think that's been the biggest shift. And I love that. In fact, just yesterday, one of my grads reached out to me and she said, I'm starting a new business and I want to call it this, with Oncology Care Center. And I said, take the word oncology out. Why don't you put in wellness? Just trade that word and see how that feels. And she came back with, oh my gosh, I love that, right? Because that's really the whole plan and where we want to go. And I have taught for 12 years, do not call it a cancer facial. Do not call it an oncology facial, right? It's a facial and it'll have some personalized custom things for that particular person, but we should be doing that for everybody anyway.
Thank you, because that I think is one of the biggest nuggets that we as the initiative and group here would like to impart, because what we are seeing is two things. One, individuals want to support the cancer community by saying, we're cancer care, or our products work for cancer, but no testing being done. And so what's happening is almost a backlash, like pink washing did, right? Where now everybody's cancer support, buy this box, buy these products, but there's no testing behind it. So now what's happening is people are going to Dr. Singhal, which is why she started her Hope and Beauty company, because now they're trying to go back to the doctors to say, these products are promising this. What do you recommend? Dr. Singhal, can you have the last word on that for us, please?
Oh, about the spa. Well, I think that there's places for different groups, right? And within the cancer center and within the care environment, right, which is your healthcare, certain things happen. And there's another environment in which healing can happen. And remember that the people who are coming for healing, whether you have multiple sclerosis, you have cancer, you have hypertension, healing is a different issue, right? You have to be mindful of the fact that they have these medical problems, and you ask in the spa, as far as I know, what medical problems are there so that you don't do certain things. But you're providing healing and wellness, and those topics are really important to everyone. And I think that when you have a certain environment, so let's say there's a massage therapist within the cancer center, they might be offering treatment type things that someone at a vacation spa might not have, because they don't have chronicity with that patient, and they don't have this sort of ongoing relationship that allows them to be a little bit more on the therapeutic side than on the, here, you're having a day that we need to make a special place for you, and let's have you heal.
Thank you. This has been, I hope, this session could go on for hours. And it was very challenging for all of us to bring everything into just an hour time frame. So I want to thank everyone, all of our contributors, all of the chat with a lot of really good information in here. And if there's anything that you need from the initiative, want to continue the conversation, Becky is on the initiative, Dr. Singhal is on the initiative. Part of what we want to do is help us frame, what we do with our clients without feeling the need to say we are medical or anything like that. Representing what we do, we represent hope, as Dr. Jonas says, healing-oriented practices, and environments. You can look him up, Dr. Jonas, and he has written how doctors should be writing hope notes in their clients' charts. What can help them with their healing? So thank you so much, everyone. Thank you, Susie. Thank you, Nancy. Thank you, Global Wellness Summit, and all of you for taking the time in over 50 countries.
Julie, you did a great job. Thank you so much. And I just want to let everyone know we're going to do a follow-up email to all of you. Like Julie said, there'll be some notes, and we'll also give you the information for all of the people that spoke today. And so we want this conversation to continue between you, between us. And really, Julie, thank you for what you have done in bringing these medical and wellness worlds together. And I think we're all benefiting from it. So thank you.
I just want to add that we share the recording of this as well as the chat in the follow-up. So you will have a chance, if you missed some of the things or some of the doctors who spoke might miss some questions or anything, you'll have a chance to see that all later.
And we always end with asking you to unmute yourselves. And let's give a round of applause to our panel, and we welcome you to say goodbye. Thank you, everybody. Thanks for joining.
Thank you.
Thank you. Bye.
Thank you.
Thank you. Thank you.